Prescott Associates work to effectively manage reimbursement relationships between providers and payers?
Given the current trends and issues that are taking place in the market today, given the increased spending that's taking place in healthcare, we're finding now that payers and providers are looking to be a lot more collaborative and cooperative in terms of alternative reimbursement mechanisms. Payers are looking for predictability. Providers are looking for volume and utilization. There's certainly a lot of synergy between the two. So when we work with payers and providers in terms of managing reimbursement relationships, we do it in an equitable way that's fair for both parties, that allows predictability for the payer and allows potentially increased utilization for the provider. And those forms of reimbursement will take place not in terms of traditional reimbursement today, as we see in terms of DRG reimbursement per se for inpatient services, outpatient reimbursement, either percentage of charge for certain services or fee schedules that are promulgated by the health plans. We see more so in terms of bundled payment arrangements, global rates, hospital fees and physician fees combined into one payment responsible for a particular episode of care. We also see issues that make sense between payers and health plans as it relates to shared savings programs. Shared saving programs where initially the provider would have upside, however this would save downstream costs to the payer. In a case like that, everybody wins in that situation. We also see that payers and providers need to work together. They cannot work independently of one another. And in this regard, we see there's a lot more receptivity between payers and providers today. Payers have concerns and issues. Providers have concerns and issues. I think they all understand now that in order to create the solution we need to implement here in this country in terms of the escalating costs of healthcare and the fragmented care we're experiencing in this country, that payers and providers need to come to the table together to address these issues. Otherwise, we don't really have much of a chance to correct this, let alone in the medium term, even in the long term. And this will take form, as I said, in terms of performance-based reimbursement, quality outcome measurements, appropriate metrics that will be put into place and worked through with the payers and the providers, and done, again, as I mentioned, in a very collaborative way so that these are achievable, they're realistic to attain these different metrics, these different benchmarks, and be able to produce quality outcomes, accountable outcomes, and eventually there'll be some surplus of providers in the process by saving some downstream costs, which saves costs within the industry and hopefully has an impact on the GDP, gross domestic product, because right now spending 17% is not sustainable. So if you try to bring all these things together, that's how we attempt to try to effectively manage reimbursement relations amongst the payers and the providers in that particular way.